From the studios of KENW on the campus of Eastern New Mexico University, it's You Should Know, featuring the people and events of Eastern New Mexico and West Texas.
Welcome to You Should Know. I'm your host, Evelyn Ledbetter, and I have the privilege of having three guests with me today. I have Nancy Parson, who is the VP of Clinical Operations at United HealthCare Community Plan of New Mexico. Nancy, welcome.
Thank you.
And then we also have Rochelle Linsky. She is the Foundation Director of Eastern New Mexico University Ruidoso. So welcome, Rochelle.
Thank you for having me.
And then also Aubrey Lott, and she is a nursing student at Eastern New Mexico Ruidoso and Quasi-Roswell. We'll go into a little more information on that, but is also a scholarship recipient, and that's really the basics of what we're going to talk about today is educational things that come, opportunities and help people get into healthcare. And so a little bit of information on this. It's we have a collaboration that's being done here in New Mexico, and according to the American Nurse Journal, New Mexico has faced a critical shortage of nurses with a deficit of over 6,000 nurses in 2023. And that's a huge number, and we're such a remote area here in New Mexico. There's so many healthcare deserts out there. But to help face this need of healthcare professionals, United HealthCare Community Plan of New Mexico and the Eastern New Mexico University at Ruidoso have teamed up to offer scholarships. And that's for students that are actually pursuing healthcare degrees and students in that career field. So there are $3,500 awards that are helping students pay for college, from travel and books and scrubs, unexpected expenses that obviously come along when you're going through those programs. And so this initiative has already helped dozens of students pursue their dreams and actually come out of that, being able to have that career in health field. So that's amazing. So Nancy, let's start off with you, and first just give me a little bit about a background about yourself.
So I grew up in the military. My dad was in the Army, and then when I decided to go to college for nursing, I also decided to join the Army. So I did a ROTC scholarship and joined the Army in 1993. So I'm aging myself here, but I served in the Army Nurse Corps for 30 years, and my parents were originally from Albuquerque. So when I was deciding where I would retire, I decided to retire in Las Cruces, New Mexico. So I retired in July of 2023, and then I joined the team with United HealthCare Community Plan of New Mexico in October of 23.
So this was a really good fit, transitioning where you have the healthcare background and being a nurse, and then helping other people to get into that same field as well.
Definitely. You know, as a nurse, I have a passion for serving others and helping others, helping to build communities, and really trying to help people reach their own dreams and goals. And so it's been a great fit working with United HealthCare and being able to see how we can impact communities and partner and collaborate and really try to help build the workforce within New Mexico.
That's really nice. And Rochelle, how about you?
Well, I've been with ENMU Ruidoso for 5 years. This role is new to me for 2 years. I came from private practice. My husband's a retired veterinarian, so we were in the healthcare industry for a long time and just had a passion for helping other students reach their goals. And so when this opportunity opened up, I was happy to be a part of it.
And along with that, you have the benefit of living in a beautiful place like Ruidoso.
It's a wonderful
And Las
place.
Cruces for you.
It's wonderful.
And Aubrey, how about you? Tell us a little bit about you and where you're at in life.
Yes, ma'am. Well, we came here from Mississippi, actually. My husband is a veteran from the Army, and we were in Fort Bliss, and then we didn't want to go home, so we ended up here, and it's a beautiful area. We've been here for about 4 or 5 years. And then I started the community college in Ruidoso probably about 3 years ago. And then I started the nursing program last year.
Very nice.
Yeah.
Very nice. It's interesting, all the different ties that you each have, and the nursing or the veterinarian or the you said you have 100 dogs that you rescue and all kinds of things on that. So that's fun.
I have a farm, yeah. And I rescued a whole bunch of animals.
Well, Nancy, let's start here. Tell us about the United HealthCare Community Plan of New Mexico. Exactly what is that? I wasn't familiar with it until I started researching on this.
So the United HealthCare Community Plan New Mexico is a New Mexico focused and New Mexico based health plan. So we're part of the state's Turquoise Care for Medicaid. We are one of the managed care organizations. And so United HealthCare is the Medicaid plan, but then we also partner with a lot of different organizations across the state, really trying to help see what we can do to make a difference within New Mexicans. We believe that every New Mexican deserves high quality, accessible health care. And so the mission for United HealthCare is to help people live healthier lives and to make the health system work better for everyone.
And we have the three big cities of Albuquerque and Las Cruces and Santa Fe are the largest. But the rest of us, we live in rural areas and that the care is not abundant. So
yes,
it's a tough situation.
Yes, and so United HealthCare is always looking for ways to continue to partner with, right now we have partnerships with over 1,500 providers across the state. And so we're always looking to grow that, especially in our rural areas. We've done a lot of partnerships with the New Mexico Doula Association, helping to train 25 doulas so that we could really help in those maternity care deserts that we have across.
I'm going to stop you there. Doula, tell me that. Okay. I'm familiar with it, but a lot of people may not be.
So a doula is like a labor coach in some ways, but they can help when you're pregnant still. They can help educate you about the pregnancy. A lot of mothers will then want the doula present at their birth. And so there are that kind of additional person, like a family support, but that educational labor support. And then after birth, they help with breastfeeding education. They help with kind of postpartum education, talk to moms about maybe postpartum depression and just ways to continue to educate and to be there for those moms. And so a doula is not the person who delivers the baby. They're not trained to actually do deliveries, but they're trained in every aspect of that educational process from the pregnancy to the postpartum period.
And of course, excuse me, if you have a healthier pregnancy, you're going to have healthier babies, and the care for that child, it's going to be a win-win all the way around.
Yes, and that's really the goal, is to really help that baby stay to term, to help reduce preterm deliveries, to really help, like you said, educate the mom to stay healthy during the pregnancy, and also helping that baby after delivery to be as healthy as they can be.
I think my doula was my mom, but of course a lot of us aren't fortunate enough to have that, and so that's an amazing program. And other things, so really just trying to help people be healthier for the long term.
Yes, and so we have partnered with the Central New Mexico University Community College in the metro area, and we have similar programs for healthcare scholarships where we're helping like emergency medical technicians, patient care technicians, diagnostic medical sonography, just anything in that healthcare realm. And we really believe that these scholarships help to reduce that financial burden for some of our students so that they can focus on their education. So the scholarships can be used, like you said earlier, for a variety of things, for travel, for scrubs, for books, or unexpected expenses that may come up. And so it's really open to really help that student get their education and then ultimately help grow the workforce in New Mexico.
You always think about the cost of college being registration and your fees or your dues, tuition, but there's a lot of additional cost behind the scenes. So this is that bridge that helps get this done.
Yes, definitely.
That's really cool. And how did the collaboration start with the ENMU Ruidoso?
Well,
and that may be something, Rochelle, I don't know if you were working on it at the same time or if it started prior to you coming into this position.
No,
Rochelle?
it was a partnership that we met, and the United HealthCare reached out to us at Ruidoso. The community plan of New Mexico reached out to us to help us grow our nursing program and to keep our nurses local, which benefits our local community and our local medical facilities as well.
And Nancy, what made United HealthCare Community Plan? What made them decide to pick Ruidoso as one of the locations?
Well, part of the ruralness of the area, and so we know that students come from some of the rural and urban areas or our frontier areas, and so we want to try to give back to those communities. And so we're focused on many different partnerships, but really trying to see what we can do to focus on that growth in those rural areas.
Okay, and that was and this program has been going on between Ruidoso and United?
Last year was our first.
Was your first year?
Yes.
Fall, spring was our first collaboration of scholarship opportunities.
Yes. And so the United Healthcare Community Plan New Mexico, we just went live on 1 July of 24 when we went live with our Turquoise Care program for the managed care organizations. So even though United Healthcare is a much larger organization and we're around throughout the country, we went live with this Medicaid plan in July of 24. So
it's really new.
yes.
I was not familiar with the Turquoise plan of the branch of, I'm not understanding for sure. It is a piece of the Medicaid program.
It is. And so it's what the state has called our current Medicaid plan. So it used to be Centennial Care in the previous contract, and this new contract from the state, it's called Turquoise Care.
Okay.
And so it's really just ways that we can help grow and give back to the communities and really try to help people live healthier lives.
Okay. And there's a website here. It's www.uhccp.com/, not splash, New Mexico.
Yes.
And so that's where you can really dig in and actually apply for the program and learn more about it as well, correct?
Yes, you can learn all about our Medicaid plan at that site. So the www.uhccp.com/New Mexico. And on that site, you can see all of our value-added services that we also have for people who are within our Medicaid plan. And so some of our value-added services include, like transportation to job interviews, to the food pantry, to church. So you can use that transportation benefit for more than going to medical appointments.
And part of this also, do you have to be a participant in the Turquoise program to be eligible for the scholarships?
No.
Okay.
So the scholarship program that we have with Eastern New Mexico University Ruidoso and with other colleges throughout the state, you do not have to be part of the Medicaid plan in order to be eligible. So you would just work with Rochelle and let Rochelle know the need, and then she can work with the student to determine what's best for them.
That's a great thing. And of course, the cost of so many people in New Mexico are on Medicaid. So quality of life, and if you have that care along, the diseases of diabetes and things, that if you can mitigate that before it actually becomes the disease, healthier people, and that saves money and makes much better lives as well.
Most definitely.
So, and tell me about, so that's the main source, and then Rochelle, let's go into this. You said you actually can go through Ruidoso. You are the foundation director.
Correct.
So you work, that's a lot of your whole program is getting funds in that help for the foundation. Is everything that's brought in through the foundation or the majority used for scholarships for the students?
The majority of it, yes. That's our main goal, is to provide scholarships so our students don't have any barriers to their education. And one of the beautiful things about this particular partnership is that when we can keep our students and our nurses local, it benefits the local facilities as well. So they're not having to relocate, they're not having to bring in traveling nurses from other areas, which, as we all know, during the pandemic and some of the other things was detrimental to our facilities, not only in the rural areas where you have sometimes housing issues as well. So this is just a win for the entire community because it keeps our local students advancing their careers in the healthcare industry in very different areas. Like Nancy mentioned, it's not just for nurses, it's all levels, and EMT and sonography and all those things that are necessary in our areas. And with not having to provide housing, it's just a win, and it reduces the cost for our hospitals. It reduces that, then they can improve the quality of care that's available in the local communities. It's just a win.
When I was a kiddo, you always thought healthcare, you thought of being a doctor or a nurse, and you forgot about all the ancillary services of being a lab tech or being a phlebotomist or being a sonographer and so many others. And that's a lot of what Ruidoso, the campus there of ENMU, they do a lot of programs that are more the technical type programs, right?
Absolutely, and there's a lot of stackable credentials where they can move up if someone in the industry needs to work on their phlebotomy skills. If you've all been in a hospital, you really want that to be a great skill that they have when they come to take your blood. So it allows them obviously to just get those certifications as they go as well and move up the ladder in their careers and increase their profitability.
So if I'm someone that I'm interested in trying to figure out how I'm going to pay for going to school or what all's out there, obviously Ruidoso probably has, the school has a website, but
Correct.
and
Our website is ruidoso.enmu.edu, and if you backslash to the foundation, it will talk about what the foundation
Okay.
services offer and how to get in touch with me. We have a multitude of offerings for our scholarships, and so we really like to tailor those to the needs of the student. As you can hear about Aubrey's story, to help them get to where they need to be.
so literally you can find that phone number and you're the resource that people can go to and talk to learn about this program and things that are offered.
Absolutely, directly to me.
And then help getting students, maybe you have, I'm going to guess that you may have several that are non-traditional students that come into these programs.
The majority of our students at the Ruidoso campus are non-traditional. So this is a great opportunity for people to increase their wealth and value in the industry, in the healthcare industry. And this partnership with United Healthcare Community Plan of New Mexico has been huge for our students. We we have students that get to a point in this partnership with Roswell that the barrier to that travel to advance their career has in the past been too much of a barrier for some of our students, so they had to redirect. And so this opportunity of these scholarships removes that barrier, and we have students that are out now able to finish that would not have been able to finish.
And without the help of people like Nancy, and
Absolutely.
that just doesn't happen.
It doesn't happen. It's
It just
amazing.
doesn't, and isn't that sad to start a program and then not be able to complete it?
Well, we graduated 3 of our nursing students last week at our graduation who walked on our stage that we had never been able to do before. And both of those students were scholarship recipients and said they would not have been able to finish without this opportunity. So
I know for
it's
myself,
life-changing.
scholarships was the way I was able to go through school. So between that and side jobs and things like that, but that's what made it work for me.
As well.
So
Yes.
that's a huge and a kudos to places that actually benefit with that. And the long-term hopes for this collaboration.
To continue to grow and expand. United Healthcare Community Plan of New Mexico really is focused on the New Mexico population and how we can help grow the healthcare workforce, but also just being there within the communities and seeing ways that we can help. And so we have done many other things like trained 150 people on mental health with our partnership with the New Mexico Suicide Coalition. We've sent 300 people using the UNM's, University of New Mexico's Health Equity Program, and so trained additional 300 people on the benefits and the differences of health equity and our social drivers of health. And so we look a lot at United Healthcare, we look a lot at the social drivers of health, which include housing, food, nutrition, transportation, some of those things that really impact your health. And so what can we do to try to help bridge that difference so that it helps that individual be healthier, help them reach their goal of being a nurse or a patient care technician or whatever they want to do. But it's really just growing that partnership and collaborating with different organizations throughout New Mexico.
Great. Aubrey, your turn. We want to hear your story. So you're, we had talked about this a little bit before we went on air, but you're actually enrolled in the ENMU Roswell campus,
Yes,
correct?
ma'am. Yep.
And you're working on your associates.
Yes, ma'am.
And tell me, where are you at in the program?
I just finished my 2nd semester. So whenever I start back in August, it'll be my 3rd. And then my graduation date is May of 2026. So it's very close.
And how does the collaboration work between Roswell and Ruidoso for you you don't travel to Roswell?
No,
You're enrolled there, but
thankfully,
you
yeah.
take classes at the campus in
Yes,
Ruidoso?
ma'am. Yep. So instead of me having to go to Roswell to do the nursing program, I am able to drive to Ruidoso, which is closer. And that helps a lot.
How did you find out about this scholarship?
I went on the college website and I saw it and I was like, I don't think I really have a chance to get that. But then Rochelle, she reached out to our nursing director and was like, hey, have your students apply. So I applied and it was like a last minute thing and I applied and then I actually got it and I was so grateful because I had been praying and I was like, I don't know how I'm supposed to do this because it's hard. And then whenever you have kids and animals or whatever else and don't have time to get, the 2nd or 3rd job.
And if you don't mind, will you share a little bit about your story? You have an uphill battle
Yes, ma'am.
You've had a lot of
Every day.
challenges that have
Yeah.
hit you. Would you share a little about that?
Yeah, absolutely. So when me and my husband moved here, he was just leaving the military, and in that transition, it was pretty hard, and just trying to find jobs, you know, in a small town is kind of hard. Well, you can find a job, but one that can, you know, help pay the bills.
Right.
You know, I mean, there's a difference if you have a big family and you need to pay for things.
And
you're
you
gonna
actually
need a
have
career.
3 children,
Yes, I do.
but you've had something else.
Yes, ma'am. So my sister passed away, going on 3 years now.
My condolences.
Yeah, yes, ma'am. And that was definitely a hard hit for all of our family. And I had just gotten all my prereqs done. I'm sorry. And after I got all those done, she ended up dying, and I was like, "There's no way I'm going to be able to go to nursing school," because I ended up having to take in her children too. And so having 6 kids, going to nursing school, going to school at all with 6 kids is hard, but definitely, you know, putting yourself through nursing school is going to be a battle, and I didn't think it was going to be possible. And then with having 6 kids, when am I going to have the time to get a job, you know?
Right.
And my husband's trying to find a career, and then it was definitely a hard time.
And so the scholarship, when you were awarded this, what has it benefited you? What have you used it on? Has it been for tuition or other things?
Transportation is a big one. I mean, driving from Lincoln to Ruidoso was, 4 days a week was pretty rough. And then just, gas is so expensive right now.
Mm-hmm.
Books are expensive, scrubs, everything's
Just-
expensive right now.
So this was just a godsend for you to
Yes,
literally to
ma'am.
come up with this.
Yeah.
Is this a scholarship that you can get more than once?
Yes, it is.
So hopefully you can possibly continue on
Yes,
for the
ma'am.
next 3 semesters
Yeah.
and go on with that.
Yeah.
That's amazing. And so you're working on your associates. Tell me what you're working on specifically right now.
So I'm trying to get my associates and finish that up, and then I would like to go up the ladder and do my bachelor's and then master's, and then the end goal is to be a nurse practitioner. I would like to have a family practice and to help, my community, and, people that struggle with income in a rural area, and be able to help them with those barriers like I've been helped.
Sure.
Yeah.
And this is an associate's in what is it? Is it an associate of science, or what is it on the
It's an
Nurse-
Associates of Applied Science
of applied
In
science?
nursing.
in nursing.
Okay.
Yes, ma'am.
And then do you have thoughts of where you want to continue on with your bachelor's, or just take it one day at a time and
Yes,
get
ma'am.
through this?
I'm just trying to get through this right now, and then my plan is to maybe find a job in a local area and maybe have them help me fund the resources in order to get my bachelor's.
So truly, you're already thinking this is maybe where I want to stay
Yes, ma'am.
and provide health care in this area
Oh, yeah.
and in New Mexico
Yeah.
itself.
I know God put me here for a reason, and I know, He blessed me with a beautiful property in Capitan, and I was actually rescuing animals before in that transition period when I didn't know if I was going to be going back to nursing or if I didn't know what I was doing. And so I ended up getting a beautiful piece of property and started rescuing animals and taking care of something and helping them get healthy, and a lot of them were malnourished, and I just rescued them and adopted them and gave them love. And
Wow.
then the opportunity with the nursing program happened, and I was like, okay, I guess it's supposed to be a nurse still, because I thought that was going to be a long time waiting. And once that, I ended up getting into the program and helping with the funding. That was great.
The doors just kept
Yes,
opening.
ma'am.
And what an opportunity that through the program, this has been just tremendous
Yep.
to get you in there. I'm excited to see where you're going to take this.
Me too.
Maybe you'll be my caregiver one of these days. You'll be my nurse prac
Yeah.
one of these days. And I know that is
I'll
a big,
also add that
sure.
we've graduated 12 nurses out of this particular collaboration program, and all of them are local. They
That's
have all
great.
stayed local,
And
either
stayed
in
here.
either in Alamogordo or Ruidoso, working for the medical facilities.
Rochelle, will you give us that website address one more time for the college there,
It's
Ruidoso?
ruidoso.enmu.edu.
Okay. And Nancy for United Health?
Yes, it's www.uhccp.com/New Mexico.
Okay. What a tremendous program, and the collaboration to see
so
what
grateful.
this collaboration has done, and then to have the person that here is the recipient of that as well.
It's so great to hear Aubrey's story live, in person. I read the article that was posted, but it's really great to see how this collaboration has helped her and 12 other students, like you said, and it's just wonderful. And I'm so proud of you and everything that you've
Thank you.
done, taking care of your sister's kids and all of the animals,
Yes,
and
ma'am. Thank
just
you.
keep going. You'll reach your dream.
Thank you. Thank you.
Absolutely.
And if you guys ever want to see all my animals and their beginning story and where they are now, we have a Facebook page, and it's Lotta Love Farm and
Cool.
Petting Zoo. Yeah.
Well, ladies, I really appreciate you being here today and sharing this information. And I know this is going to, if you get one student out of this, but it'll be interesting and fun to see how this continues to grow over years in the future.
Wonderful
Definitely.
stories. Thank you, Evelyn.
Thank you all for
Thank you
joining
very
me.
much.
And to all of you, thank you for watching today. And we will see you next time. Cheers.